Purpose, power, passion. Purpose, power, passion. Do I sound like a drum major? I certainly hope so, because this morning I want to pump up the volume. I want to infuse you with all the feelings of awe engendered by our remarkable past, our exceptional present, and of course, our shared, absolutely fabulous future. Purpose, power, passion. I do love alliteration. It's not only that these words illustrate our commitment to the League's mission and core values, it's also that they explain how we bring them to life. Without purpose, power, and passion, how could we animate our core values of caring, integrity, diversity, and excellence? Without purpose, power, and passion, how could we promote excellence in nursing education to build a strong and diverse workforce to advance the health of our nation? These words have been running through my mind all summer. In so many ways, they sum up our beloved National League for Nursing. They give resonance to our identity as the voice for nursing education, as the premier organization for nurse faculty and leaders in nursing education. It is only through purpose, power, and passion that we can build the NLN home for transformative excellence. Listen to these words: the home for transformative excellence. They paint a compelling picture. And I'd like to share with you the narrative that goes with this vision of the future through the words I began with. This is the NLN vision that I'm talking about. Purpose, power, passion. We've spoken often of the purpose of the NLN. In fact, the words of our mission and core values I spoke aloud just a few moments ago encapsulate that purpose. But how does the League achieve our goals and objectives? How do we do it? Where does the power come from to continue to strive toward excellence, to rev up and keep our engine going? The short answer is that the NLN's power comes from you, from all of us. The longer answer is NLN members are 35,000 strong. We are a portrait of inclusivity with 1,200 plus schools, representing nurse faculty and leaders in nursing education in all types of nursing programs: doctorate, master's, baccalaureate, associate degree, diploma, and practical vocational. We are agencies, organizations, companies committed to excellence in nursing education. We, the NLN, are the best and the brightest, a diverse workforce of faculty members, researchers, and pedagogical scholars, leaders who mentor and serve as role models for future nurses and nurse educators. We are citizens and leaders of the global community from countries around the world. And colleagues, NLN members are generous. League power comes from thousands of you who graciously contribute your time and intellect. You contribute as task force, panel, and committee members, exploring and addressing significant issues in nursing education. You contribute as Academy of Nursing Education Fellows, fostering excellence in nursing and providing visionary leadership. You contribute as NLN ambassadors, keeping members and other constituents up to date on NLN programs and activities, and keeping the NLN informed on faculty issues. You contribute as certified nurse educators serving as leaders and role models, promoting nursing education as a specialty area of practice, and communicating to students, peers, and the academic and healthcare communities that the highest standards of excellence are being met. You contribute as centers of excellence faculty whose public recognition energizes nurse educators everywhere to explore new and challenging opportunities, to improve teaching, and to share the results with the nurse educator community. You, my colleagues, contribute as members of 24 affiliated constituent leagues all across the country, supporting the mission of the NLN at the local level. Our constituent leagues are the face of the NLN at the local level. And you contribute as participants in NLN conferences, workshops, and webinars, the year-long programs in our Leadership Institute, the immersion experience. I call it the Deep Sea Diving Conference. The scholarly writing retreats, expanded this year to 3 sites with the generous help of Pocket Nurse. And right now, right this minute, you are contributing here at our annual summit. League power also rises from our history. For 118 years, even older than I am, the National League for Nursing has channeled the might and leadership of nursing education. For 118 years, the National League for Nursing has been a source of excellence and innovation. For 118 years, the League's dedication to the profession of nursing and to our nursing and health and our nation's health has helped improve the human condition. So we've been building this home for transformative excellence for a very long time. And in the words of an old gospel spiritual, I don't feel no ways tired, and we have no intention of stopping. We will never put our proverbial feet up and rest on the laurels of 118 years. We all know that there's much more work to be done. In our home for transformative excellence, we will continue to promote excellence in nursing education to build that strong and diverse nursing workforce to advance the nation's health. Speaking of words that touch the soul, how about to advance the nation's health? Let me repeat what I said earlier this year when the NLN Board of Governors announced the change in our mission statement to explicitly state what has been implicit, that the health of the nation is the impetus for all the League does. Colleagues, we added 5 little words, only 5, to advance the nation's health. 5 little words, but they are oh so powerful. They resonate with the core of who we are. As educators, researchers, administrators, leaders, and nurses first, we are committed to improving the nation's health. And here I'd like to take a moment to pay special tribute to our exceptional leader, President Kathy Schultz, and to our gifted and knowledgeable board of directors, board of governors, of course. Could we have a round of applause? They saw that the new emphasis of the NLN mission on advancing the nation's health dramatically raises the focus of the organization above what we do to concentrate on why we do it and who we are. And not only that, also thanks to our visionary board members and their commitment to a culture of engagement, we are about to unveil a redesigned advisory council structure that is consistent with our mission, core values, and strategic plan. The beneficiaries of these changes are not only nurse educators, but the students we teach and the millions of patients nurses care for over the course of our professional lives. Kathy and members of the NLN Board of Governors, we just want to thank you from the top to the bottom. Thank you all for contributing to the electricity in this room. And I mean all, everyone here. I can feel the energy in the room kind of shaking the place. The electricity in this room is filled with your enthusiasm and with our appreciation. Because now I'd like to try and convey the heady atmosphere enveloping the NLN as we plan for our historic move to a new home in our nation's capital. We're calling it our home for transformative excellence. Building on the NLN's mission and core values, in order to prepare nurses to lead, change, and advance health, we have envisioned the development of 6 NLN centers for nursing education. And these are not necessarily centers in the bricks and mortar sense. Rather, they are a way of organizing our thinking and doing, a way to continue to lead in the areas we believe are crucial to the future of nursing and nursing education. Did I say excitement is building? I mean it sincerely as we plan these 6 NLN centers. Of course, it's helpful that the NLN is already doing quite a bit in all of these areas. So as I name the 6 centers, I will just share with you one example of how NLN is already involved in this establishment of the center. But don't worry, you'll hear more about the range and scope of NLN programming during the business meeting tomorrow. So the first center is the Center for Transformational Leadership. Transformational leadership can be seen throughout the NLN's programming and in the recently published Vision for Post-Baccalaureate Nursing Education, calling for the development and implementation of new models of master's and doctoral education that embrace diverse pathways to advanced nursing practice. We have noticed at the NLN that it takes leadership to initiate any type of transformation. It's almost like you can't get much done without leadership. And so leadership cuts across differences, whether we're talking about disciplines or schools of nursing. Leadership is the requisite skill to teach, consult, research, provide care, and manage organizations, or simply to manage your life. Next, the second center is the Center for Excellence in Geriatric Nursing Education. In gerontology, of course, we have the growing ACES program. That's Advancing Care Excellence for Seniors, ACES. This is thanks to the Hartford Foundation, the Hearst Foundation, the Independence Foundation, Laird R. Medical, and the Community College of Philadelphia. It takes an entire community to fund this program. And I know that there are so many of us who are going to need this program in a major way soon. Our birthdays keep rolling around. Our third center is the NLN Center for Innovation in Simulation and Technology. In this area, the CIRC, I hope you've heard about CIRC. It's our Simulation Innovation Resource Center website, which is the first in the nation specifically dedicated to nursing. It expands continually with more tools for teaching with technology. We definitely need a Center for Innovation in Simulation and Technology if we're to catch up with our 4- and 5-year-olds. our children and our grandchildren, technology stars who continue to outpace me personally in techno-knowledge. Number 4 is the Center for the Advancement of the Science of Nursing Education. Now, this is an interesting one because we've kind of figured out in nursing that we need evidence-based nursing practice. We still haven't quite figured out that we also need evidence-based nursing education. But in this center, that's what it's going to be about. In research, for example, we bring together leaders in nursing education research to identify national issues that need to be addressed, to develop recommendations for the national research agenda, and to suggest partners to help fund nursing education research. And we just did this past April. Fantastic leaders that we brought together. The next one is the Center for Global and Diversity Initiatives. So are you thinking about all these centers and where you fit, where you can fit with the center? If you find yourself not fitting with any of them, you've got to fit with global and diversity. As long as you're in this world, you're a part of the global community, and we're all diverse. On the global and diversity front, we continue to work through ANESA, the NLN's Joint Global Task Force with the NLNAC and the International Council of Nurses Nursing Education Network, helping to bring together the community of nurse educators from all around the world. We believe that global equals diverse, and that managing diverse ideas is one of our biggest challenges. And now we're coming to last but not least, and that's our Center for Assessment and Evaluation. Just this past summer, in the critical area of assessment and evaluation, we instituted ACTION, which stands for Advanced Collegiate Testing and Integrated Online Network. And by the way, colleagues, at the end of my presentation, there will be a test to determine how many of the acronyms you can remember. Don't worry, I would never do that to you. This innovative platform performs at the highest internet speeds to meet the needs of the nursing education community. Even from these brief descriptions, you can see why we are so very excited. But colleagues, there is so much more that needs to be done. We would like to be able to pursue our mission with the confidence that comes with a secure future in a permanent home, the NLN Home for Transformative Excellence in Washington, D.C. To do this, we turn to you, our colleagues, to bring these plans to fruition. To achieve our NLN Home for Transformative Excellence, we are initiating a capital campaign. With the NLN vision of a strong and diverse nursing workforce, the joined power of our membership, our legacy as the oldest nursing organization in the country, and the future historic move to DC, all framed within the passion of 6 extraordinary centers of caring. The NLN is dedicated to advancing the nation's health. We can only do this with you. We turn to you to advocate for our mission and core values. We turn to you to consider a leadership role in the campaign, and we turn to you to support the campaign. This is simply because to really succeed, as our vital work goes on and the League continues to thrive, you orchestrate our purpose, provide our power, re-energize our passion. With this move to the capital of our great nation, we will gain a unique combination of internationally prominence, proximity to our important partners in healthcare education, and at the seat of the healthcare policymaking in the U.S. to address the nurse and nurse faculty shortage and the opportunity for expanded facilities with broadened capabilities at a single site. As I have said multiple times, we are excited, enthusiastic, and raring to go. But there's a bittersweet flavor as well, because we will be leaving a city that has been the NLN's home for more than a century, and we will miss it. We will miss looking out our windows to see the Statue of Liberty on the one hand, and the World Trade Center site with its just opened beautiful memorial on the other. As we've just passed the 10th anniversary of 9/11, I'd like to share a quote from Paul Goldberger, writing in the New Yorker magazine last week. He wrote, "After September 11th, it looked as if the future of Lower Manhattan would depend entirely on what we did with Ground Zero. But the past 10 years have proved the opposite. Lower Manhattan healed more quickly around its gaping wound than anyone would have thought possible, with a flourishing of housing, restaurants, cultural facilities, and parks, while politicians, developers, bankers, architects, and almost everyone else quarreled over the future of Ground Zero. The rest of Lower Manhattan, as well as the rest of the city, quietly pulled itself together." So yes, colleagues, the staff and our members of the National League for Nursing will certainly miss New York City, the Big Apple. We will miss Wall Street and the interesting collection of humanity that we encounter during lunch breaks. We will miss the pace, the rhythm, and the vibrancy. We will miss subway experiences that can only be described as close encounters of the personal kind. We will miss one of the most wonderful cities in the entire world. But as we look back, we also look forward to a new vision, new challenges, new opportunities, leading us to flourishing in our new home, the NLN home for transformative excellence, in the beloved nation's capital. Thank you so much. Thank you so much. We are now open for questions and answers. If you've noticed, the whole sentiment, theme of this summit has been a dialogue. Can we have a dialogue? And so we are very committed to that, and we've saved time everywhere to have some questions and answers. Feel free to come to the microphone. You'll see some of our colleagues who are staffed there. I've told them not to act only nice to those who come to the microphone. So it's open, colleagues. Any questions at all? We'll even take comments, not just questions. Could you say who you are and what school or where you're from so everybody will know who you are?
Good morning. My name is Dr. Michelle DeBose. I'm from Wisconsin, and I am the interim director of nursing at Herzing University. Thank you for your encouragement. My question is, and you may have already said this, and I apologize, I may have missed it, is when is the move to D.C.?
Well, you did not miss it because I did not say it. The move is toward the end of 2012, which is tomorrow, it feels like, but it's the end of 2012 or the beginning of 2013. And the closer it gets to being 2012, I'm starting to say the beginning of 2013. Our lease is up November 2013, and we would all like to be out of there before somebody's saying, we're moving your stuff out into the streets. So in order to do that, we're making sure that we have a little bit of time and, you know, some cushion to have made the move. And we want to be in D.C. for the 2013 summit.
Okay.
Which, you know, we're going to have a big celebration, that summit in D.C.
Okay, thank you.
Yep.
Bev, Nancy Langston, Virginia Commonwealth University. I rise simply to say, it's hard sometimes when you have a powerful sermon to even know what to say. I so appreciate your energizing this NLN. Your concept of alliteration with passion, purpose, and power, I think is exactly what we need. The concept of home, I think, is even more important.
Yeah.
We started on a journey to create a home for nurse educators in the mid-90s, and thank you for giving us that word. This is the place where we come together to share our joys, our sadness, our struggles, and we do it in a safe place. Thank you for calling it our home.
Colleagues, I just want to mention that that's Dr. Nancy Langston. She said who she was, but she's also one of our past presidents. And she has been a stalwart. If you know Nancy, she's a warrior anyway. So she has been so significant in the development of the NLN. In fact, all of our past presidents have been involved. And so thank you, Nancy, for all that you continue to do.
Good morning.
Morning.
My name's Patty Connect. I'm the director of a practical nursing program in Philadelphia. And I want to say ditto, really, to the last comment. The purpose, power, and passion as the 3 Ps. I guess quickly I think of 2 more Ps that we've heard over the last 2 days, which is partnership and persistence. And just to add on to the home piece, yesterday as we were listening to our colleagues, what rang through to me is home, our home of the nursing profession. And although the interdisciplinary is huge for all of us, the interprofessional is huge also. So I want to applaud NLN for their inclusivity and also challenge all of us to educate our students as to who each member of our profession is, from nurse practitioner to nurse anesthetist to clinical nurse specialist to LPN to RN, and thus they'll educate the public because it's there where we start to build our profession to true unity. So thank you very much to NLN.
Thank you, Patty. You know, you all have the access to badges that said, you know, I'm a member of the NLN, I advance the nation's health. To me, that means you're basically saying in a very nice, soft way, I'm a warrior. I'm here to make something happen. And sometimes, colleagues, you have to be ready for the battle. Patty Connect is also a warrior and ready for the battle. She's bringing it to all of us, and she is a brilliant young woman. It is so wonderful to come to the summit and just to rub up against all of you, your brilliance, your dedication. Talk about energizing. It energizes me. It gives me the energy to go the next mile. And all of us need that at some point. We need somebody somewhere to give us a little bit of energy. I don't think you know how much you give the staff, the Board of Governors, how much you give to us. Next speaker.
Thank you very much. I'm Suzanne Sutton. I spoke the first day too. I'm from the Medical University of South Carolina and USC Upstate. Thank you so much. I have to tell you that in 1990, I graduated from an LPN program in the Army. I returned to school to get my ADN, and I had the good fortune to run into Jane Query, who was one of my most favorite instructors as the ADN program. And then I got my BSN at UNC Greensboro. And I've had the good fortune to run into Lynn Llewellyn, who was one of my instructors. And I understand Donald Kotz is here, but I've not seen him yet. And then I ran into one of the people at University of Tennessee who is, all of these people are one of the reasons I'm in nursing education. They've all engendered this passion for being a nurse educator and for being a nurse. And I want to tell you how exciting it's been to see them and to meet new people today. This week, I've met so many people who are very encouraging, which I just love. I love, and I think that this is one of the best organizations for nurses and for educators, and I want to thank everybody for being here.
Yay. I just want to mention that Lynn Llewellyn was, when I was Dean of Nursing at A&T, she was one of my faculty. So, very special touch there. Thank you so much. And UNCG, right down the way. We call it down the road in North Carolina. Next, please. And this is the last question that we can take so we can stay on time.
My name is Carrie Lindbergh, currently in Tennessee. Bev, I wonder if you would speak a little bit about the rationale for moving to D.C. and how that connects with the new theme of advancing the nation's health. I know that there have been significant discussions about this within the board and so on, but I think it would be helpful for us to hear your, that's a plural, the vision of how to advance the nation's health and how Washington, D.C. is going to help make that possible. Second comment, just to say that I really applaud these new centers. They seem much more comprehensive to bring together and fulfill the essence of what NLN and what nursing education at its finest can be. And I would encourage all of those here to get involved in one way or the other, and even the olders like myself would like to be engaged in that wonderful endeavor of moving us forward. Thank you very much.
Thank you, Carrie. Everybody knows Carrie, right? Carrie Lindbergh, just one of those living legends that walks around here and just amazing. Carrie, it's really about the opportunity for partnering, for the partnerships that we can have with nursing education. Our colleagues are, most of the organizations for nursing education leadership are there in that community for not only nursing education, but for education in the larger sense, because the major organizations for education are also there. And then, of course, healthcare organizations also reside there. It's an amazing opportunity for partnering. And then we go over to the possibility of working, of course, with the government and trying to help them do the best that they can. We talk about advancing the nation's health. We probably can give a boost to our government as we are there, helping them to think through things a little clearer. So we have a vision that we're going to be there, but we're carrying those 6 centers with us, so it's not just about that we're going to be in close proximity. It's that we're going to be doing major business while we're there. We're going to be creating a new way of looking at nursing education while we are there. We're going to have something special to bring to the table while we are there. So, but thank you, Carrie. I want to be as clear as I possibly can be. When we educate and advance those nurses who are nurse educators, then we will also advance and educate those graduates. Then those graduates will give better care to patients. That's exactly how all of this rolls out. So thank you for the opportunity. Thank you for listening. We listened to you. We heard you, and we will move forward. Thank you so much.